everyone. A very good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us. So, the topic of today's session is Heroes Fight for Health. Join the Prostate Cancer Awareness. And this initiative is supported by Zydus Life. Prostate cancer is a significant health concern in India, ranking as one of the most prevalent cancers among men. According to WHO data, prostate cancer accounts for approximately 7.7% of all the cancer cases in Indian men, with an estimation of 105,000 new cases reported this year. Additionally, it is a leading cause for cancer related deaths, with around 30,000 fatalities in 2020 alone. These statistics highlight the urgent need for enhanced early detection, prevention strategies, and treatment options to address the growing impact of prostate cancer in the country. So, in this session, we are going to discuss and highlight the holistic prostate cancer care by integrating physical, emotional, and psychological support. To begin with the discussion, first I would like you all to join me in welcoming our expert who is going to provide us with insightful information on prostate cancer awareness. I would like to welcome Dr. Ashay, consultant medical oncologist, hematologist, and stem cell transplant physician, director Sunrise Onco Center and SunAct Cancer Institute. Good evening, Dr. Ashay. Welcome to the discussion.
Hi, good evening, Dr. Sumedha, and good evening, all viewers.
So let's delve into the discussion, Dr. Ashay. To begin with the discussion, first I would like to ask your views on what are the most pressing gaps in the prostate cancer awareness in India today and how we can effectively address these gaps to improve public knowledge.
Thing is that the pressing gaps is, always been, access to healthcare. So the predominantly our healthcare is, gathered is mainly the tier one cities and tier two and tier three now, slowly evolving. So we have, we always, like screening, like people go for diabetes, blood pressure, all these problems. But again, that is not quite regular. In the terms of cancer screening, it's, it's much later it comes. So many of these people, they will have some problem with, some urinary problems or something like, backache because it has, but they do are not aware of it. They will always, complain it, this may be related to old age. So I think the knowledge about it is number one thing, and then the access to healthcare, because going to the doctor and, getting a treatment. So I think these are two things. So first of all, we need to create awareness about prostate cancer. Yes, this can be symptoms, or whether you are at high risk or not. I think these are the something which is there. If we could address this, I think many of the problems can be resolved.
Thanks, Dr. Ashai, for these insights onto that. Moving ahead with the discussion, since we talked about the pressing gaps, in your experience, what are the most common barriers that prevent men from screening for prostate cancer care and how we can overcome with these obstacles?
First of all, I would like to tell many of the times cancer is considered as a stigma. Like so many of the things, people, lot of people we have seen, why you not came initially. They will always say, yes, we were aware that this was cancer, but we are fearing. So I think fear is, I think, one of the most important factor when it comes to the cancer screening. People don't want to know. Like people, the commonest thing where we see this is a breast cancer. Like breast lump, they will be carrying for many months together. But even in the prostate, many of the patients, they will be having these urinary complaints on and off, and they must be also having a backache for which they must be going to their local physician and taking a treatment. But overall, when we are looking at, the first thing is the fear of a cancer. Nobody wants it to get a cancer screening done, because they feel that if they get detected with cancer, they will be subject to chemotherapy, radiation, and a whole lot of stigma attached to it. I think many of the times I feel that society really outcasts these people. The moment they get diagnosed with the cancer, or a lot of maybe associations, with the family and a lot of other things which are there. So I feel that is some of the most important barrier. So to make them understand ki if early diagnosis could be made, we can make an impact on the cancer. That is something which need to be, that idea should be cultivated in the brain of these people.
Very rightly said, Dr. Ashai. I think screening is really important when it comes to any cancer, not even just the prostate cancer. Moving ahead with the discussion, I would like to ask how can educational campaigns be tailored to different demographic regions to ensure that the prostate cancer awareness reaches diverse community very effectively?
I always feel, okay, like, health education should be a part of a basic schooling only itself. I think because I think healthy habits and other things, because in India, almost 50% cancer are lifestyle associated. Well, 50% cancer, there is apparently no cause. Means what is a lifestyle related means it can be as simple as bad habits like addictions, smoking can be there, drugs can be there, alcohol, obesity, lack of physical exercise, physical activity, stress, lack of sleep. So there are so many other factors which are there. And I think more and more these things are called, well, I always say, in India, if I could just modify the lifestyle, I can avoid 50% cancers. Now, remaining 50%, that is what we are looking at. And when we are, saying that these cancers which are there, so one of the most important factor is that, this because we have a quite different demographics, like the tier one cities will be different, the south will be different, north will be different, we have really a very, diverse population. So I always feel we have to consider all, possible things, especially social stigma associated with it, because many of these female communities can be orthodox, where this is not a very common discussion. So I feel when we are doing in the tier one cities and tier two cities, like it's mainly should start from the educational institute itself, right from the childhood, how we can get into it. And we have a lot of networks of government institutions are there, or even the various corporates which are there now. Definitely slowly it is increasing. Just random screening test should be done, as a pack of health packages. It really doesn't have any significance, because patient doesn't know or relatives doesn't know how to interpret it. So that is something which is there. And once we go there, like if you must be aware of that, because there's a lot of rural population is there, where you have these Anganwadi workers and other things which are there, which essentially are into basically health sector. But even they made aware of this. I think probably just documenting how many elderly population is there and other things. I think if we could combine all these approaches, that she is going to be more effective, rather than just, and it's just not for prostate cancer also, but it will encompass all possible cancers.
Thank you, Dr. Ashay, for these insights. Since you mentioned about the lifestyle changes and 50% lifestyle changes can lead to more good ways towards the treatment of cancer, maybe you can provide us with some recommendation when it comes to lifestyle changes, dietary changes, or I would say, how can one person get indulged into the physical exercises when it comes to prostate cancer?
So one of the most important thing in lifestyle, as you rightly pointed out, is a exercise, and a sedentary lifestyle. If you just 4 years back, the WHO theme was sitting is a new smoking. So if like now people are working from home, like a lot of people, and if you're sitting for more than 8 to 10 hours a day, that is something which you makes you prone. And the reason behind is there is an increase in obesity, and that is one of the most important risk factor for breast cancer, prostate cancers, and colon cancers. The other thing is that is the bad habits, like many of the times now we see a lot of movies, smoking, if you look at, it is increasing again, so smoking is one of the important risk factors. Alcohol, these are the two factors for bad addiction. Third thing is a lack of, like now everyone is in hurry, ready to eat food, a lot of preservatives. So at least one fresh fruit in a diet, and at least one fresh salad in the diet. I think the vegetables are much stronger as compared to the fruits, so that is something has to be there. Fourth, even the Western world is following is yoga, some sort of exercise and yoga and deep breathing or meditation. So these are one of the most important factors. If we could just have these habits of yoga or some sort of breathing exercises along with reducing exercises, and at least 30 to 45 minutes of brisk walk. I'm not saying you join a gym or anything. Brisk walk, which is totally free of cost. So if you could do this, and last and the most important, avoidance of stress, because now I think you would have discussing, some, I think 2 3 days back, a death because of stress, on the work, at a work atmosphere. So I think stress and a good sleep, essentially a 6 to 8 hour sleep, I think these are the essential keys now, because we will see, late night, parties, and people are awake late night because of the various factors. So I think it is just not 6 to 8 hours sleep, but sleeping on time. Like at least by 10 to between something like 10 to 11, what we say, and getting up by 6 or 7. So I think these are the something which is very easily doable things. If we could just make these lifestyle changes, I think most of the things will be taken care of.
Thanks, Dr. Ashai, for such a wonderful recommendations that people can opt to. Moving ahead with the discussion, I would like to ask, in your view, what are there some of the myths or misconceptions when it comes to the screening of prostate cancer and the treatment?
So the thing is that first of all, the one of the most important misconception is that cancer means death. No, the prostate cancer, I will tell you, like I'm in this field for more than 18 years now. So what I've seen is that the treatment has changed the paradigm, and the conventional chemotherapy and other things are not there. So the chemotherapy and cancer are synonymous. That is something which is not there, which is existing. The most other important thing is screening. Now when we are doing screening, because there is a most important test which we do is a PSA, prostate specific antigen. But how to interpret it? Almost data says 15 to 20% of the patients, despite of the fact they can have normal PSA, still they can have a cancer. The cutoff value we say more than 10% is there. There's a 60 to 70% chances there that they might harboring a prostate cancer. So just raised PSA doesn't mean anything. It can be high in urine infections also, or we say prostatitis, or somebody has got the per rectal examination done. So all these factors they might even cause raised PSA. So this is one of the most important myth is there, PSA if you do. The thing is that whether you are at risk or not, because the ideal recommendation is between the age group of 55 to 17, 70. And why this recommendation is there, because whenever we are doing screening, the basic rule of screening is that person for whom we are doing screening, at least his lifespan should be at least 10 years plus. Then the only reason you should be doing, otherwise in asymptomatic individuals we do not advise. So they should be getting at least their annual PSAs done, and especially those people, if they have any family history of prostate cancer in less than 60 years of age, any person in their family first degree relative, means way blood relative, then these are the people they should definitely undergo a prostate cancer screening after discussing with the any physician or urologist or oncologist. But these are something there. But do not get feared, if the PSA is high means I'm having a cancer. This is one of the most misconceptions most of the people are having.
Thanks, Dr. Ashay, for these insights. Since we talk about the misconception and myths, I would like to ask a question about the treatment part. So, what are the latest developments or advancements are there when it comes to prostate cancer treatments?
Prostate cancer treatment, by and large, if I have to divide it, it is two parts. One is curable, means for a localized prostate cancer, versus advanced stages. So localized prostate cancer, you can treat with surgery. Now we have a newer advances like robotic surgeries are there, or minimally invasive surgeries are there. So this can be done. Or for those especially who are not fit for the surgery, a newer technique of radiation, basically called SBRT, which is just only focuses on prostate and can be finished in the span of 2 weeks. So the treatment is also is not very long. So this can essentially can control the prostate cancer for a longer time, followed by some sort of hormonal treatment. When it comes to advanced prostate cancer, then the main treatment is hormonal, basically, because prostate cancer is hormones driven. So simple hormonal tablets can be. Chemotherapy is required in very few subset of the patient. But a newer thing which I have to tell is that we are now living in the area of precision medicine or personalized medicine, where we try to find out why somebody got a prostate cancer, whether there is some tumor genetics is there. I'm not saying hereditary. What I mean is that cancer genetics, what we study, and we try to find out what are the strengths and the weaknesses of the cancer, and we can use accordingly. So there is something called as a BRCA1, BRCA2. Now this mutation is very common because of Angelina Jolie. Somebody is heard of. So 1% of the patients they can develop a prostate cancer. So if that is there, then some simple oral tablets are beneficial in this. So now we are moving towards era where immunotherapy is also there, where just providing immunity, a cancer can be controlled or can be cured. So these are the various approaches are still there, but essentially most of these treatment are purely on the outdoor patient basis, and patient can lead their normal life.
Thanks, Dr. Ashay. And I think it's really insightful to know about the latest development and advancements when it comes to prostate cancer. Moving ahead with the discussion, if we talk about the holistic care, in your view, can you explain how a holistic care approach and address the comprehensive need for prostate cancer patients beyond the standard medical treatment?
Yeah. So whenever I say, cancer, I always say, somebody gets malaria or dengue, only one person is affected. But somebody gets a cancer, the whole family or the whole house gets affected. It is not just a single person who is there. So I think it essentially, if I have to divide it, the treatment of the disease and the other impacting factors. So one of the most important things is disease. Definitely, a doctor is going to take care. Like you see oncologist, but what lies beyond it? So most important thing is diet. Many of these cancer patients you will always see they're very cachexic. So diet from day one. So you ask the patient a relative, they will say doctor has started a treatment and in worsened. But when we actually track back and we see how much calories they are having, how much proteins they are having, then we see There is a gross deficiency of all these things. So a good diet or good nutrition, there is no replacement for that. The next thing is that many of these patients, there is a lack of exercise. It's a very common myth. They will be told that you should have a just bed rest only. So that is not something which is there. A moderate amount of exercise, which is basically supervised by experts, is one of the most important, and that reduces also mortality and keeps the patient productive. Third and the most important is the psychological factors, because whenever somebody gets a factor, definitely they are depressed. So I have always seen in my practice, those with a good social support or good friend circle, they always do better than those people who are lonely. And now we have quite we have nuclear families, other things. The concept of the joint families are not there. I'm not saying so, but what I mean is that when you have some sort of support groups in the terms of the family, because many of the times I've seen that these people get isolated by the family. They've been told to stay away from the kids. When you are on treatment, don't go near the kids. So that it make them more and more depressed. I think those kind of myths, if we avoid and we provide them good social and psychological support. And last and important thing is that prostate cancer has affinity for the bones. It makes patient very crippled. There are a lot of bone metastases are there. So appropriate treatment of this bone metastasis, or if you are able to maintain bone health, most of the prostate cancer patients can remain productive and they remain well with good quality of life.
Very wonderfully you explained, Dr. Ashay, and I think you really rightly said that isolation is not the thing that should be done with the people who are suffering from prostate cancer. And I think this is the geriatric age group disease,
Yeah.
and people actually are very vulnerable at this stage, and doing such things make them more depressing when it comes to treatment part. Moving ahead with the discussion, I would like to have your views on what are the some of the examples of complementary therapies that can be integrated into prostate cancer care and how they can contribute to patients' overall well-being.
Yeah. So as I've mentioned, the like hormonal therapy and other things are there. But one of the most essential thing I would just like to create, like you would have heard about, okay, when the females get menopause, especially their bone health gets affected, and they might have some mood swings. So similarly, when we are treating prostate cancer, we introduce artificial andropods. So
Yes.
there is various treatment. Either we give injections or we do orchidectomy, where the testes are removed. So I think that creates there is a lot of fatigue is involved. They always complain they are having a bony pain, backache. So I think some sort of if counseling is done before, so then most of these things can get solved. So counseling is one of the most important factor, where you make patient aware, about what are the possible, nuances which are going to come in the, whatever next time or whatever is there. So I think if they are aware of these things, many of the things are taken care of. Second thing is, I've said, diet, complementary. So some sort of nutrition. No, but only thing is that there are lot of nutrition facts you would have heard about. Avoid sugar, do not have sugar. Avoid milk, and people have to say, but it is not like balanced diet is one of the most important key. It should be comprised of everything. Even the normal sugars, they are essential for life. So that is something which is there. Yes, what we are trying to say is avoid refined sugar, which will be in the colas, soft drinks, candies. So these are the artificial sugars which are there. Third thing is, I will say if we have some support groups and other things, most of the times patient always feels about it. Why I am alone? Why I got, did I do something wrong? And like we have a lot of saying, yeah, आपके पहले कर्म की सजा है, पाप की सजा है. It is very bad things. So we should make them understand it is nothing. It is just like an accident. Like when get
Yeah.
accident, you don't feel that. So I think that kind of support, if we are able to give it, and people, though they come up, a lot of alternative therapies, though there is no clear evidences to support that, but I always feel, a good diet and good natural things, I think they can help to improve the patient's quality of life. So there should not be any dramatic changes in their lifestyle. There should not be any dramatic changes in diet pattern, and we should try to remain as normal as possible. If you even over sympathize them, they get that feeling, bad feeling, that they are certainly ill. So we should try to keep them in their normal routine. That is something which is very essential.
Very rightly said, Dr. Shai. Since you mentioned about the support groups, I would like to ask, like, what are your views onto that? What makes a patient support group very effective, and how can individuals who are suffering from prostate cancer can find or create such support groups to tackle with this journey in the prostate cancer?
So there are various support groups, even if you go online now, this is the era, everyone is having data, everyone is having a mobile, and we have got into the culture from work from home. So you need not go anywhere. So there are various communities which are there as a support group. Like, there is Indian Cancer Prostate Support Group is there. Then there's OHAPO, basically they have created. So there are certain communities, and besides that, there are other cancer communities also can be there. So how the cancer support group helps him means whenever the patient is taking treatment, usually most of them have gone individually to the doctor. They feel they are alone suffering, and when they see somebody, so what happens most of the times when I tell patient something, they always feel, doctor, have you experienced this? How you do know? Because this is something you are telling you as a theory, right? But we are passing through it. But somebody who is suffering through has recovered out of all these things. If that patient tells them, then it is more effective. Or caregiver tells them, yeah, this is more effective as compared, it is like theory versus practical, what we say. So there are certain support groups, so they can discuss their all anxieties because they might have a share a common problem, and somebody might have a solution how someone else got overcome that. That's something which is very important. Second thing is that a newer therapies have come up. There is no access. Somebody has already undergone a therapy. How they got access to, when that knowledge sharing happens, though they can discuss with their caretaker. But this is something where is the first time information is there. How the treatment side effects, how somebody is overcoming. Are there any myths? So all these things can get discussed when they are actually a part of support group. They can join any community definitely, because many of the patient, they want anonymous, they don't want to disclose this, but that also can be maintained. And there are various support groups where there is a caretakers are there social workers are there. There can be some financial issues can be there, whether how to seek financial help. So there are a lot many questions which are there. Somebody been through it, guiding them is going to be more fruitful than somebody just telling them whatever there is information, because all this information will be available on the internet.
Very rightly said, Dr. Ashai. Moving ahead with the discussion, when it comes to caregivers and the family support, in your view, what strategies can caregiver use to provide emotional support to the prostate cancer patients, and how can healthcare providers better assist caregiver to this role?
Yeah. So I always tell, because when we look at as oncologists, you will always be complaining about, doctor to patient ratio, how much time we are giving and other things. So most of the time the treatment part is always discussed, but what is beyond treatment, there are various issues, what are the financial burdens, because they are not able to go to the work or something like that, even caregiver. So I always say, ki, we always speak about the patient, but we never think about the caregivers. Even
Yeah.
those issues need to be addressed, because if we make them aware about what are the other possible situations are there, and what complications can arise, and how they can be vigilant about this, I think many of these things can be easily done. Okay, so we can teach them, there are certain aspects can be there. Now the thing is that when the caregiver is aware about all these possible things, many of the things, for everything they did not come to the clinics, and that is something which can be done. And other thing is that if we are able to resolve their myths and their queries of the caregiver as well as patient, so I always say it is just not so. We now try to provide, there are cancer sisters are there, because they spend the maximum time when they are providing the care. Some sort of infusions are there, or blood collection is there, so they are spending a time. So we try to indulge in these activities. Also, always we give them a call back, so that what happens once they are there, how is health, that gives them a positive feeling that somebody worries for them, and so that also gives a positive impact. So overall, it is just not a single person, or it is just not simple, giving a medicine to like malaria. It actually involves a lot of people coming together to help the patient.
Thank you, Dr. Ashai, for such an insightful information onto that. Moving ahead with the discussion, in your views, how can advancement in technology such as telemedicine, or I would say the online forums, improve access to care and support for the prostate cancer patients?
Yeah, so it is not only for prostate cancer but other cancers also, and there are a lot of studies. Though as of now, the medical legally you are not permitted to write any chemotherapy or anything online basically. But the thing is that in many of these things, I will give you a simple. Even I am currently doing a project in Northeast, where there is very access to healthcare is not there, and how we can help the patient. So online platforms are definitely useful. With like conducting like lot of seminars like this, which can be attended, and like people nowadays, even if you have to change something, I will give you a simple example. How to change my settings in my mobile, I can just go to YouTube, type that, and I can get a video on that. So I think people have
Yes.
these habits. So I think if we could create a lot of cancer awareness videos or other things are there where experts are involved, and basic questions. I'm not saying that we should know the
Yeah.
advancements only, but at least basic healthcare diagnosis, how to do follow up, what are the different treatments which are there. Definitely advancements you can get, and I mean like the technology when we are looking at. but there is a lot of read between the lines. You if you read just internet, I think it give a false expectations also or misconceptions also. It's either way. So when the experts they hear from the experts directly, so this kind of contents, I think probably that way makes an impact. As of now, telemedicine, yes, you can access any of the experts on the field, and lot of things can be sorted out. People can have virtual consults, so that is not there. But still, I think even after COVID time, there is a little bit of what I can say acceptance to the for the telemedicine. But still, somehow the patient prefers a personal touch when they really wanted to meet their caregiver or a physician.
Very rightly explained, Dr. Ashai. So, in the end, to conclude, I would like to ask that what recommendation or advice you want to give to the patient who are newly diagnosed with the prostate cancer or maybe at the verge of this disease?
Yeah. So first of all, I would like to just recommend about screening. So randomly doing PSA is not making anything. We usually recommendation is between the age group of 55 to 69 or 70, where at least annually you can get a PSA done. And actually, if you are having some urinary symptoms, like what we could say lower urinary tract obstruction means the patient has to get up multiple times in the night, to go to washroom. They always have a feeling that they have not adequately passed the urine, or it is incomplete, or there is a urgency or some burning sensations, or if there is a urine blood in the urine. So these are the various symptoms which are there. They should meet a surgeon or urologist and get a digital rectal examination done, especially those who are at a risk, where at least there is a one or two family members or anybody who is less than 60 years of age affected with the prostate cancer. So these are the people they should contact a urologist, and they should have a regular checkup done for this. As far the diagnosis is concerned, stage 4 cancer, people always ask me, what is my stage of my cancer? And they will always feel that stage 4 cancer means death, but that is not always, especially in the prostate cancer. With the latest advancements and the medicines, even with the stage 4, people are living for years together, 10, 15 years. So prostate cancer doesn't mean a death at all. There are a lot of things you can continue your normal routine, but only thing is that you need to be compliant with your treatment, meet a proper expert in the field, and take the treatment, because there are a lot of newer things which have come up. The prostate cancer can be treated with the surgery, with the radiation, with hormonal treatment, with chemotherapy. There are certain newer treatment come like radionuclide, where what we do is that there are various radiation injections are created, which are only they get attack only the prostate cells. They do not attack any bad cells. I mean good cells. Sorry, my bad. So these things are also there. So there are a whole lot of new things have come up. So, but only thing is that diagnosis on time. Do not fear about cancer, and taking a proper treatment. These are the virtual keys when you are. And it is just not about treatment, but a good diet, good sleep, avoiding stress, and some healthy, habits like exercise. I think these are the lot of things. If we could do, we would have a better results.
Thanks, Dr. Ashai, for such advices and recommendation to the people who are suffering from prostate cancer. And I think this is going to be really helpful for them. So, in the end, to conclude, our objective for today's discussion was to explore and emphasize the importance of holistic prostate cancer care by integrating physical, emotional, and psychological support. And I'm confident that our experts have addressed this topic comprehensively and effectively. I would like to extend my gratitude to Dr. Ashai for his insightful contribution and for sharing his expertise with us today. Thank you for joining us and to contributing this important conversation. Thank you so much.
Thank you, Dr. Sumedha. Thank you, everyone. Thank you. Bye.